If you see, we will discuss about respiratory tract infections. Respiratory tract can be broadly divided into upper respiratory tract and lower respiratory tract. So, defenses of the respiratory system. Nature has given us many mechanisms to protect us from any type of infection in any place, including the respiratory tract. So, first of all, these nasal hairs, even they are the protection. Hairs that we have in nose, they are protecting us from major dust or particles which can go inside. Then we have mucociliary escalator in respiratory tract, which functions upwards for upward movements of this sputum and mucus, and that is why you can cough and bring out the sputum with this help. And coughing is also a mechanism for protection. For lower respiratory tract also we have alveolar macrophages. Common infections of the upper respiratory tract: sore throat, pharyngitis, tonsillitis, etc. As you can see, important bacterial causes, most of the time they are caused by viruses. Okay, coronavirus, adenovirus, rhinovirus are the important cause. Bacterial causes, as you can see, Streptococcus pyogenes is important cause. Corynebacterium diphtheria, especially in children who are unimmunized, Haemophilus influenza, etc. Viral causes, adenovirus, Coxsackie virus, etc. Clinical manifestations are not very specific. Headache, sore throat means pain in throat. This is a picture of pharyngitis, inflammation of the pharynges. If you see, for any child who is having headache, fever and all these things, first thing you should check is his pharynx, because most of the time these are the cases of pharyngitis, and you can get the picture like this. Tonsillitis, as you can see, the tonsils are enlarged, and also you can see the pus tonsillar abscess. Otitis media means infection of the middle ear. As you know that this is upper respiratory tract is linked with the middle ear. Croup or acute spasmodic laryngitis. Croup or acute spasmodic laryngitis means there is inflammation of the larynx, and this is a very specific feature of this laryngitis is barking cough or hoarseness of voice. That when the larynx is involved, then there will be change in the voice. A severe inflammation and obstruction of the upper airway, larynx. Important organisms which can cause this are Bordetella pertussis, Corynebacterium diphtheria, etc. Barking cough or hoarseness is a typical feature which is highly suggestive of croup. Worse at night and can last 5 to 6 days. Decreased breath sounds, dyspnea, difficulty in breathing, fever, and respiratory insufficiency can happen as complication. So we can do throat culture, take the sample from the throat, laryngoscopy, visualize the larynx, and also you can do neck x-ray. Depending on the type of organism, you can start the antibiotics, analgesics, and other therapy can be given depending on the condition of patient. Now coming to lower respiratory tract infections. In lower respiratory tract infections, bronchitis, inflammation or infection of the bronchus. It is common in children under the age of 2 to 3 years. Mycoplasma pneumoniae can also is a common cause in children more than 6 years of age. Clinical features: fever, dyspnea, non-productive cough, which differentiates it from pneumonia. Bronchitis is a mild self-limited disease. Treatment is almost same for all of them, not much different. Bronchiolitis, infection or inflammation of the bronchioles. It is mostly a viral infection, and most commonly caused by respiratory syncytial virus, mainly in children less than 2 years of age. And if you see, important point in this is that it is not bacterial infection, so antibiotics will not work in this also. If we can give antibiotics if we suspect that there is some superimposed bacterial infection. So remember, bronchiolitis common cause is respiratory syncytial virus in children less than 2 years of age. Pertussis or whooping cough. Pertussis or whooping cough was a very common disease before the advent of the vaccine against this bacteria, Bordetella pertussis. Bordetella pertussis is a gram-negative cocobacillus, means neither it is cocci, neither it is exactly rod shaped, in between something. It does not, only reservoir is human for this also, Bordetella pertussis. And we have a very effective vaccine for this, DTP vaccine. DTP here means D is for diphtheria, T for tetanus, P for pertussis. This we give in children. It is a part of immunization schedule in Saudi Arabia also. Epidemics can happen every 3 to 5 years, especially as we don't have the cases, commonly the cases for this. And treatment, antibiotics are useful only in the early stages. This is a picture of this Bordetella pertussis. If you see on gram staining, it has got a typical appearance, thumbprint appearance. Thumbprint appearance means if you see the bacteria are close together and in between you can see spaces. So it has got typical thumbprint appearance. We use a medium, Bordet Gango medium, for growing this. On that medium also we get a typical picture, bisected pulse or mercury drops appearance. Pneumonia. Pneumonia is inflammation of the pulmonary parenchyma. It's common in childhood but occurs more frequently in infancy and early childhood. Pneumonia can be of various types, as I will discuss. Bacterial pneumonia can be divided into nosocomial or community acquired. So how do you diagnose a case of pneumonia? Can anybody tell? How can you diagnose pneumonia? From this definition, how will you confirm that this? Yes? Okay.
X-ray.
Yes. X-ray is very important actually. If you see the definition of pneumonia, it is inflammation of the pulmonary parenchyma. Lungs, inside lung. If from sputum you can say there is some infection, but you cannot say exactly from which place it is coming. So you need to show that lung is involved, and that you can show only with radiological evidence. So radiological evidence is also equally important. There are different types of pneumonia based on the place. For example, lobar pneumonia, bronchopneumonia, interstitial pneumonia, and based on the bacterial causes, we can have two types, as I will discuss. Before that, the important bacterial causes, Streptococcus pneumoniae, often called pneumococcus or pneumococci for plural, is a very common cause of pneumonia. How it looks like? It is gram-positive cocci in pair. Pair means two cocci together. If you see this picture, this is a very enlarged picture. You can see these are two cocci which are together. So this is basically Streptococcus pneumoniae. Other bacteria can also cause pneumonia like Pseudomonas aeruginosa, Proteus, Staphylococcus aureus, etc. Mycobacterium tuberculosis, if you see, as such, is a very important cause of lower respiratory tract infection. Viral causes, many viruses can also cause, adenovirus, influenza virus, measles, that I will tell you later also. Fungal causes, pneumocystis, Cryptococcus pneumoniae, histoplasma, etc. Nosocomial pneumonia means pneumonia acquired in hospital. So here, if any patient is admitted to the hospital, he was not having any pneumonia, but he develops pneumonia after some time. That time we take as 48 hours. And the most common organism is Staphylococcus aureus, usually associated with Staphylococcus aureus. also caused by gram-negative bacteria and many more bacteria. Problem is that for any nosocomial infections, the bacteria which causes infection is highly drug resistant. So this is a common problem. Community acquired pneumonia means outside the hospital, in normally as the people develop from community pneumonia, usually presents as lobar pneumonia. This is a picture for sputum sample showing presence of Streptococcus pneumoniae or pneumococci. If you see these small dot-like structure, if you can see, this is gram-positive cocci. What is the color of gram-positive cocci? Purple or violet color. For clinical features, fever, malaise, cough, chest pain, etc. are common features. Diagnosis, as it is a lower respiratory tract infection, pneumonia, so sputum is an important sample. We can do gram staining or Zeal-Nielsen staining if we are suspecting tuberculosis. We culture on different media. You can also do blood culture if you suspect septicemia or bacteremia. Course of treatment, antibiotics are very useful in this, especially the penicillins, amoxicillin, etc. Besides that, the supportive features, bed rest, oral intake, antipyretic. Complications can happen, necrosis, empyema, pneumothorax, etc., lung abscess. Now, for other organisms, there are some types of disease and the organism which causes it. You must remember the names, okay? That this disease is caused by this organism at least. Biological weapons, inhalational anthrax. It is caused by Bacillus anthracis. We don't have much time, but this is actually very interesting organism. There was a biological attack, or you can say there was an attack in US in which they were sending in mail these letters, spores of Bacillus anthracis. That was reported in maybe in 2002 or something like that, 2001. So it is actually can be used as a biological weapon also because of its potential to form spores. It forms spores and it can cause many conditions. Basically, in terms of respiratory tract infections, it can cause a respiratory tract infection. This anthrax, it is a gram-positive rod, and it can be easily treated with penicillins. Viral infections. In viral infections, influenza virus and respiratory syncytial virus are the two important viruses which can cause this respiratory tract infection. So this is not important. Fungal infections, remember the name of fungi which can cause the infections: Pneumocystis xerovicae, Blastomyces dermatitis, Histoplasma capsulatum, coccidioidomycosis caused by this Coccidioides immitis, and its symptomatic form is known as valley fever. Aspergillus causes aspergillosis. It can also cause respiratory tract infection. Atypical pneumonia. Atypical pneumonia means not by common organisms. These organisms are somewhat different. It includes viruses also and some bacteria. Important bacteria are Mycoplasma pneumoniae, Chlamydia pneumoniae, Chlamydia psittaci, Legionella, Coxiella burnetii, etc. The common thing about most of these organisms is that they are not like normal bacteria. They have somewhat different cell wall. Some are, for example, Mycoplasma pneumoniae is cell wall deficient. So the drugs which act on these microorganisms, drugs that affect cell wall of bacteria, for example, penicillins, will not be effective against these bacteria. So this is very important from clinical perspective. Mycoplasma pneumoniae, sometimes the pneumonia caused by Mycoplasma pneumoniae is known as walking pneumonia because it is very mild. Person has pneumonia but he is able to walk and do his normal routine works. That is why sometimes the term walking pneumonia is used. If you see the treatment, it is tetracycline or erythromycin and not penicillin. For most of the other bacteria, if you remember, it was penicillin, ampicillin, amoxicillin, but here it is different, tetracycline. Why? because it does not have cell wall. Similarly, for chlamydial pneumonia, if you see, treatment is tetracycline or erythromycin, no penicillin. Legionella pneumophila, it causes Legionnaire's disease. Here also erythromycin is better than penicillin. It is sometimes common cause of infection in coolant towers. It can spread through the coolant towers and centralized air conditioning, Legionella. Psittacosis or ornithosis. It is basically a type of zoonotic pneumonia which can be contracted by inhalation of bird droppings infected with Chlamydia psittaci. So, ornithosis or psittacosis is caused by Chlamydia psittaci. Here also treatment is tetracycline. We use the term Q fever for Coxiella burnetii, which it is caused by Coxiella burnetii. It is also a zoonotic infection in which cattle, sheep and goats are the primary reservoirs for human. Here also, as you can see, the treatment is tetracycline. So, for this, need to remember the names of which organism causing which disease in pneumonia, okay? And the things that I have discussed, that are all those things are important. In tuberculosis also, I have told you, the one summary slide is there, and besides that, whatever I have discussed, for OSPE examination, as you are aware, all the pictures, okay? You can leave those pictures of cell wall of Mycobacterium tuberculosis. All the pictures are important. So just if you can do this, inshallah, it will be easier for you. Okay, thank you.